You'll always be my favorite what if. Many things can happen during a pregnancy, such as a stillbirth, placenta abruption, or miscarriage. I've spent months researching this assignment, but because of the lack it's spoken about, there is a lack of research. Many women go through this tragic loss every day, and because there isn't much talking about it, they usually go through it alone and don't know that many people are suffering with them. Pregnancy loss are a lot more common than people think, such as Sapara KJ from the Department of Obstetrics and Gynecology said that it happens to 1/3 of every pregnancy. This just comes to show that even if we may think that it's not happening, it really is, and it's affecting people every day. Piner M. Hallett says that about 30 to 35% of all miscarriages happen before implantation is even complete, which means that most women would usually get their period on time and wouldn't even know that they're pregnant. Miscarriages can happen at any stage, even before conception. Although pregnancy losses are common, some things can help prevent them, and although they cannot be 100% prevented, there are some things that can help. Cohen JS says that the first trimester pregnancy loss rates rose with women who had higher age, higher weight, were smoking before or after pregnancy, had a previous miscarriage or pregnancy loss, or a previous C-section. Again, so only some of these can be helped, such as the smoking and the weight, but others cannot, such as the age and the recurrent pregnancy loss or recurrent C-section. San Lazar Campillo from the Pregnancy Loss Research Group says that the main cause of pregnancy loss is chromosomal abnormalities, which right here you can see is the prevention of the developing fetus to actually develop properly. Most of these happen in the first trimester, but some do go on to the second trimester and later turn out to either be stillborn or a late miscarriage. Some other reasonings for a pregnancy loss are a fall, consuming drugs, or a medical condition the mother may have. This comes to show that a lot of pregnancy losses are out of the mother's control and usually cannot be prevented, but some can, such as the consuming drugs. Lee Tad from the Departments of Obstetrics and Gynecology said that there are many reasons for recurrent miscarriages, which means that you usually have more than one, 7% being chromosomal abnormalities, 10% being uterine abnormalities, 15% for endocrine disorders, 6% for undetermined reasons, and 55 to 62% are for coagulation platelet disorder. There is usually a way to cure the platelet disorder, but there are many reasons for pregnancy losses in general. But with recurrent miscarriages or pregnancy loss, there are a lot more researching on it because it is happening and they further test to see what was going on. Although this is a tough subject to talk about, there is a lot of reasoning as to why it's so common and why it's not being better prevented. There is a lot of unknown when it comes to pregnancy or pregnancy losses. But if people become more knowledgeable about the subject, I think we can bring some light to it and better educate ourselves on the subject. Right here you can see we have a normal fetus with the brain and the face and the arms. And right here we have an abnormal fetus where you can see the sacs right here and the sacs right here, but there's no developing fetus, which means that it is a blighted ovum, which is not mentioned in there, but it's another word for a miscarriage. Right here we have miscarriages, causes, and risk factors. Again, chromosomal abnormalities. There are also hormonal imbalances, nutritional deficiencies, and control disorders, sexually transmitted diseases, unhealthy habits, pregnancy at age 35 plus. As said before, some of these can be helped, such as the unhealthy habits. You can stop the unhealthy habits, such as right here, this woman is smoking, there's drinking, and then there's some that can't, such as the uncontrolled disorders. Right here we have symptoms of miscarriages. There's vaginal bleeding or spotting, unusual vaginal discharge, intense cramping, pain in the lower abdomen, and then signs of miscarriage are womb abnormalities, such as that one over there. No heartbeat after 6 weeks, chromosomal irregularities, abnormal blood results, and right here we have types of miscarriages, which is complete, incomplete, inevitable, missed, and threatened. Complete is where all the fetal tissue has been expelled. Incomplete is where You would usually need a D&C to get the rest out. And the inevitable is the process of expelling the tissue, and in MIST, it's where the embryo dies, but the womb is still in there. The threatened are symptoms of miscarriages, but it is not fully a miscarriage yet until you get any of these symptoms or find that the baby's heartbeat has stopped beating. And then right here we have a miscarried baby. And that is all. Thank you.